Hello, everyone, and welcome. I'm so glad you're here for the Bioidentical Hormones Facts versus Myths. I am Dr. Nicole Smith, a board certified nurse practitioner and founder of Anti Gravity Wellness. I specialize in helping women navigate perimenopause and menopause with evidence based personalized care, and that includes hormones. So, here's what you can expect today. We're going to bust some myths. I'll give you the real facts backed by science. We'll look at a case study and we'll talk about who should consider BHRT, bioidentical hormone replacement, and how to get started safely. So the session is going to run 20, 30 minutes. And of course, there's always a chance for Q&A. You can drop your questions in the chat at any time. And yes, if you stay until the end, I've got some free gifts for you, including a mini course and a discount on services. So let's get started. Let me introduce you to Laura. It's not her real name, HIPAA. A real client, though, who did come to me feeling completely exhausted. She was late 40s, gaining weight despite eating clean. She was snapping at her husband, not sleeping well, and was feeling really disconnected from her body. She had tried some things like magnesium, melatonin, progesterone cream from the health food store, but nothing was working. Her primary care doctor ran some basic labs and told her everything looks fine. Does that sound familiar? Well, here at Anti-Gravity Wellness, we ran a full hormone panel doing the full functional labs and saw the imbalances clearly. And that started her on bioidentical hormone protocol because she was deficient for sure. Within weeks, her sleep improved, the hot flashes calmed, her mood stabilized, and she told me, I finally feel like myself again. That transformation is what today is about, replacing fear and misinformation with hope and real solutions. So, what are bioidentical hormones? Bioidentical hormones are hormones that are chemically identical to the ones your body naturally makes. They're typically derived from plant sources like yams or soy and can be delivered in forms like creams, troches, pellets, patches, or oral tablets. They're not synthetic in the same way as traditional hormone replacement therapy used to be. So that's a key difference that we'll talk more about today. Let's clear the air with some of the most common myths that I hear. Myth number one, BHRT, bioidentical hormone replacement, is dangerous. The truth is, when prescribed and monitored correctly, BHRT is actually safer and effective. Myth number two, it's the same as the pill, like oral contraceptive. The truth is, birth control pills contain synthetic hormones and are meant to suppress the system, not help to replace your hormones. BHRT is bioidentical and it's customized to your needs. Myth number three, you don't need hormones after menopause or even during perimenopause. The truth is, hormones affect every part of your body, not just fertility. They affect your brain, your bones, your skin, your heart, and these all still need support well past menopause. Myth number four, natural equals not effective. The truth is, bioidentical equals matched to your body equals more effective when dosed properly. Myth number five, you only need hormones if your symptoms are bad enough. Truth is, prevention matters. Don't wait until you're falling apart. Now, let's talk about science. The Women's Health Initiative back in 2002 scared a lot of women and providers away from hormone therapy. But that study used synthetic hormones in women over 60 who were 10 plus years past menopause, among other women who were also in that study. But overall, the results were exaggerated and it wasn't as bad as they made it sound in the news. When we look at newer data and real world outcomes, we see that bioidentical hormones started earlier, monitored closely, can be a game changer for reducing osteoporosis, cognitive decline, and cardiovascular issues while improving quality of life and not increasing the risk of breast cancer. It's not about guessing, it's about data, dosage, and expert care. So here's a quick comparison. BHRT is customized to your body using plant-based hormones that match natural ones. Conventional HRT, which back then was using synthetic or non-identical hormones, was often a one-size-fits-all approach. It's not that synthetic HRT never works. It does, but it's that BHRT is often better tolerated, more flexible, and aligned with how your body functions and tends to give us less of those undesirable side effects. So, if you've been wondering whether hormones could help you, here's a list of the top symptoms that we see improve with the addition of appropriately dosed and monitored BHRT. Hot flashes and night sweats, one of the number one things. Low libido and vaginal dryness, very important, and sometimes requires even testosterone replacement, which is something we do offer at Anti-Gravity, and a lot of places do not. Sleep issues, often related to progesterone. Brain fog, sometimes also related to your thyroid. So we take a look at all of these. Weight gain around the midsection. Cortisol can affect this as well as the sex hormones. Mood swings, irritability, and anxiety. Fatigue that doesn't go away with rest. You are not crazy. You are not broken. These symptoms are real and they are hormonal, and we can do something about them. So, who should consider BHRT? If you're over 35 and you've noticed changes in energy, mood, sleep, or cycle, could be appropriate. If you've had a hysterectomy or are postmenopause, we should definitely talk about that. Yes. You've tried supplements, but nothing is helping. Maybe it's not the right supplements. Maybe you need some BHRT. Maybe it's time. Or you want to be proactive about aging and prevention. There's also a place for it there. So there are some contraindications, and we'll discuss during the consult. But for most healthy women, BHRT is safe. The key is working with someone trained in functional and hormone-based care, like myself and my team. So here's how we do things at Anti-Gravity Wellness. I have developed my 4-step hormone harmony method after working extensively with many, many women and refining this process over and over again, producing reproducible results again and again. So step 1, we understand the cycle and the symptoms that the woman is coming in with, getting a really in-depth history and physical. Step 2, we test, we don't guess. We use blood work, a Dutch test with the dried urine, and we have other advanced labs as well. We can do a GI map, which is a stool test, many other things. Step 3, tailored hormone, lifestyle, supplement, and nutrition plans as appropriate for each woman that's individualized to her and will change with her changing hormones. And then step 4, we monitor and adjust to keep you thriving. This method allows us to support your life, not just put a Band-Aid on your symptoms. So safety is everything. That's why we test and follow up every 3 to 6 months, depending on your plan. We track labs, symptoms, blood pressure, and side effects, always aiming for that sweet spot. No symptoms, no risks, just results. So if you're on BHRT and no one's checking your labs or talking to you regularly, that is not real care. It can be very dangerous. So let me answer a few common questions. Will BHRT make me gain weight? No, it should not. In fact, it often helps regulate weight. However, progesterone sometimes can make you gain a little bit of water weight, but it is not fat. So that is a very important distinction. Can I still take it if I've had a hysterectomy? Yes. And in fact, we want you to be on hormones because even with a partial hysterectomy where you have, one or both of your ovaries are still left, it's going to kick you into an earlier menopause. So we want to modify based on what organs you still have left and what your symptoms are and all that. Is it safe with a family history of breast cancer? So possibly. It's not an automatic, no, we can't ever use it. We evaluate the risk individually, and there are other things we can look at, like, topical estrogens are not absorbed in the body. So, but that's an individual conversation. How long will I be on it? So that depends on your goals and your symptoms, but most women benefit from using this for years and well into post-menopause, because when we stop taking it, we stop getting the beneficial results. Pretty quickly, those results start to go away when we take away like the estrogen. Those protective factors go away. So here's what makes our approach different. You're not a number. You are seen, heard, and supported, which is really, really important for a lot of women who feel very dismissed in the standard Western medicine care. And I understand because I was there too. We have telehealth access with expert guidance, which is really convenient for everyone. So that's why I'm able to go Washington into Oregon. We're also going to be expanding into Idaho as well. So it makes it very convenient. I have a full care team. It's not just a prescription pad. So I don't run a pill mill that you can see out there. And, we don't just put a pellet into everybody and say, okay, you're good to go. Also, you have access to meal plans, fitness guidance, supplement protocols, nutrition guidance, and really we're here with you every step of the way. All right, so let's wrap it up. BHRT is safe and effective when done right. You deserve real answers, not you're just getting older. Perimenopause and menopause are not death sentences. The right provider and plan can change your life. You don't have to feel tired, disconnected, or dismissed. You can feel strong, clear, and alive again. Thank you so much for being here today. I know your time is precious, and I hope this session gave you some clarity and confidence to take the next step in your hormone journey. If you're ready for real answers and real support, I'd love to help you get there. We have some free gifts. First is the BHRT Starter Guide. This is packed with info to help you prepare and ask the right questions of your provider. So if you're not with us here at Anti-Gravity, or our services are not within your price range right now, that's totally okay. I understand. But this little starter guide will help to kind of get you going so that you can bring it with you and have your questions ready to go, and be a more informed patient and advocate for yourself, because there's still a lot of misinformation out there and just a lack of education with a lot of the primary care providers, which is not necessarily their fault. They're really overworked. As we know, it's hard to even find a primary care provider at all. But if you are interested in our services, you can get $50 off your initial hormone consult. So if you use discount code HORMONE50 at checkout for the full initial consultation, which includes a 60-minute Zoom with me to go over your health history, current symptoms, functional tests such as a Dutch Complete or a GI map, which is a $600 value alone, lab orders, reviewed supplement recommendations, unlimited chat with me to answer questions, and you get your initial nutrition consultation, fitness consultation. All of that is within that one big visit right there. And then you get your follow-up with that. So it's all included. And then we have membership level programs as well. So, but you get $50 off if you use that discount code HORMONE50. And then we also have our free 5-day hormone reset mini course. And this is a self-paced way to start balancing your hormones right now. So use the link in the chat that I'm going to be dropping in there, or you can scan the QR code on the screen to claim these free gifts. Let's help you feel strong, energized, and fully alive again. You deserve nothing else. Less. You deserve nothing less. Sorry. I will see you in the next session. Bye.